Hello, this is Dr. Grande. Welcome to my video on intelligence assessment in counseling. So first, let's look at the question, what is intelligence? Well, there is no single definition for intelligence. Matter of fact, there are quite a few different definitions for intelligence, and what intelligence is, what that construct actually means, has been debated for many years. Many researchers do believe that there is a general intellectual ability, and that's what many of the intelligence tests measure. Most researchers agree that intelligence is related to, in some fashion, learning from experience, abstract reasoning, and adapting to the environment. So taking a look at a few of the researchers and theorists that have contributed their own definitions of intelligence. Binet defined intelligence as the ability to judge, reason, and comprehend well. Terman defined it as the ability to carry on abstract thinking. Thurstone also defined it as a capacity for abstraction. However, he specifically looked at it as an ability to inhibit an instinctive response, conceptualize a different response, and use that response to modify behavior. Looking at some additional researchers and theorists, Spearman viewed intelligence as a general ability, but focused on the ability to understand relationships and correlations. Wechsler viewed intelligence as a global ability to act purposefully, to think rationally, and to cope effectively with the environment. Gardner believed intelligence was the ability to solve problems, while Sternberg focused more on achieving goals. He viewed intelligence as an individual's ability to achieve what they want to achieve in their socio-cultural context by using their strengths and adjusting for their weaknesses. So those are just a few researchers and theorists and their definitions of intelligence. There are many more, as intelligence has been studied for a long time. Just as there are many different definitions of intelligence, there are many theories of intelligence. I'll be looking at just three here. The first one is Spearman's theory. It's the two-factor theory. So Spearman believed that intelligence was divided into a general intelligence factor, which he referred to as the G factor, and then a set of specific factors, such as vocabulary, reading comprehension, the ability to make computations, and the ability to reason mathematically. Now, he believed that these specific factors overlapped with the general intelligence factor, but that the general intelligence factor was the more important factor of the two. Thurstone developed the multi-factor theory, and this theory postulated that there are 7 primary mental abilities. The numerical ability, that's the ability to perform mathematical processes, verbal comprehension, word fluency, memory, reasoning, that's the ability to solve problems, spatial ability, which is the ability to visualize relationships in 3 dimensions, and perceptual speed, which is the ability to perceive items quickly, such as details or similarities among objects. Thurstone did not find evidence of an overall G factor like Spearman did, but later on he was more open to the idea that the G factor did in fact exist if it was conceptualized as divided into primary factors. Cattell and Horn's theory was based on the idea of fluid and crystallized intelligence. So the fluid intelligence, they believe, was one's inborn abilities, which were primarily determined by genetics, whereas the crystallized intelligence were acquired skills and knowledge. They believe that both types of intelligence develop throughout childhood and adolescence, but they believe that crystallized intelligence continued to develop over the entire lifespan. So taking a look at intelligence tests are designed to assess cognitive characteristics. They attempt to evaluate strengths and weaknesses as they relate to cognition or cognitive abilities. And they serve several purposes. Intelligence tests are actually very good at predicting academic success. They're useful in assisting with job placement decisions, and at a clinical level, they can help to identify potential problems. Intelligence tests are different than achievement and aptitude tests. Achievement tests measure current knowledge, and aptitude tests predict capabilities that could be realized with further training and education. There are many different types of intelligence tests. I'll be taking a look at just a couple. The first one is the Wechsler Adult Intelligence Scale. And you'll note here there's actually 3 different Wechsler scales I have listed. The first is the WAIS, which I mentioned. The next is typically called the WISC, and that's the Wechsler Intelligence Scale for children. And the third one, typically referred to as the WIPSI, is the Wechsler Preschool and Primary Scale of Intelligence. All the Wechsler scales use what's called a deviation IQ, which is actually a standardized form of measurement. So it's a measure with a mean of 100 and a standard deviation of 15. There are other deviation IQs that are not considered standards, but the Wechsler, all the Wechsler scales are considered standardized. So just like a T-score or a Z-score, that's the level that a Wechsler score is on. Always a mean of 100 and always a standard deviation of 15. So the WAIS is used for the age range of 16 to 89, the WISC from 6 to 17, and the WIPSI from age 2 to 7. All these instruments yield what's called a full scale IQ, which we typically refer to simply as IQ. All the Wechsler scales are fairly complicated. They combine 4 indices, and each of these indices have potentially up to 3 subtests. It's important to understand that there is no single definition for intelligence, but there's also no single definition for IQ. Meaning there's different instruments that use the term IQ, or intelligence quotient. Usually when someone says IQ, however, they are referring to the Wechsler scale's IQ. So here are the classifications for the WAIS. And you can see on the left is the full scale IQ, and then the classifications on the right. So IQ greater than or equal to 130 indicates very superior intelligence, 120 to 129 superior, and so on, all the way down to less than or equal to 69, which is extremely low. As with all instruments, remember to take into account cultural factors, other environmental factors, testing conditions, and the results of other instruments. And even though the WACE is fairly reliable and valid, it's important to consider other factors when looking at an IQ score. In the end, it is just a number. It can be an important number, but it is just a number. It needs to be taken in the context of other data that's gathered. The other intelligence test I want to look at is the Stanford-Binet. It has a mean of 100 and a standard deviation of 16, so it's a little different. It also yields a full-scale IQ, but again, as I said before, when people say IQ, they're usually referring to the Wechsler scales. Generally, the Wechsler scales are considered to be better at assessing the mainstream population, and the Stanford-Binet is considered better at assessing those at the high end and low end of the intelligence spectrum. So what contributes to intelligence? Well, genetics account for about 50% of individual score differences, and therefore environment obviously accounts for the other 50%. For a long time, it was largely believed that intelligence was, or genetics rather, was really what explained intelligence. And intelligence was a number, how it was measured, like IQ, for example, was a number that did not move a lot through the lifespan and could not be changed and wasn't influenced by environment. But we now understand the environment plays a huge role, 50%, and there are factors in the environment that can help increase intelligence, such as family support, particularly when parents are involved in the educational process. Socioeconomic status has an impact on intelligence. Medical care, including proper nutrition, and of course education. I want to end this video with providing you some advice with regard to assessing intelligence. It is a very sensitive topic, and when you're assessing clients for intellectual ability, I think it's important to underscore how there are a lot of different abilities and skills that factor into intelligence. And just because an individual has a high score, an average score, or a low score, doesn't necessarily mean certain career paths or personal goals can't be achieved. And it's not unusual for an individual, for a client, to have, just like any other individual, certain intellectual strengths and in some areas intellectual weaknesses. Everybody has those. And I think a key in terms of using the information you gather in intelligence assessment and counseling, one of the keys is to try to help the clients capitalize on the strengths and to compensate for the weaknesses so they can still attain their treatment goals, especially when those treatment goals are ones that are typically related to intelligence. For example, moving up in the workforce, seeking higher education, goals that are similar to those. And again, always appreciate with your clients that intelligence and intelligence assessment is a sensitive area. It's a sensitive area for clients, it's a sensitive area for everyone. I want to thank you for watching this video. As always, if you have any questions or concerns, feel free to contact me, and I'll be happy to assist you.